HPV is the human papilloma virus. It's a sexually transmitted virus and it's actually very, very common. A lot of women will never know that they have the infection. For women to have regular pap smears is the only way that they would know that they have the HPV virus and the cellular changes that is caused by the HPV virus. There's a lot of different types of HPV. It's divided in low-grade and high-grade types. Your low-grade types of HPV is responsible for your genital warts, while your high-grade HPV is usually your precursors to cancer. Cervical cancer is cancer of the lowest part of the uterus or the mouth of the uterus. It's that part where the cervix connects into the vagina. We know that cervical junction is a high. The HPV targets that area, and it's exactly there that you get your abnormalities. There is additional factors, for example, smoking, early age of first sexual contact, if you have other sexually transmitted diseases, or if you're immunosuppressed, for example, if you have HIV or AIDS. About 5,000 women are newly diagnosed with cervical CA every year, and most of these women had a bit of abnormal vaginal bleeding, had a little bit of pain, maybe had abnormal vaginal discharges, but by far the most of them didn't suspect that they have cancer. And cancer have no symptoms until you are at a very late stage. Cervical cancer kills 10 women per day, which is very sad because it is completely preventable. Now we first use primary prevention, and that is to try and prevent the HPV virus transmission. I already discussed the role that condoms play. There is also HPV vaccines available in the private sector since 2008. But now our national health system also provides a vaccine program in schools for young girls, usually between 9 and 12 years. It's very important that they get this vaccination before there's any sexual contact. Definitely, my youngest is in grade 4, and I hope that she'll be vaccinated in school this year, and for the older one as well. I'm definitely. I would like parents to really take responsibility, not only for themselves, and have their pap smears and have their follow-up clinic appointments, but I also want them to prevent cancer in their children, and by vaccinating them in the school program is very, very important. And they should please sign consent and just support the whole system. We're doing it for all our women's health.